Hi there, everybody. So I'm Barbara Ruby. I'm one of the quality coordinators at MidCentral, and I'm part of the working team. Our aim at MidCentral is to reduce opioid-related constipation by 50%. Our baseline data showed about a constipation rate of 13% for patients who are on regular opioids, so we want to try and halve that in STAR 2. And our STAR 2 is our older adult and rehab ward. We've decided to focus specifically on regular opioids and try and keep really succinct in what we're doing. We've tried several things at various levels and at various stages throughout our journey. We've, I think, worked from CAP Coast, patient information, which they adopted from county, so it's just great to see how everybody's sharing work and adopting for their local settings. We're working very strongly on nursing documentation, or all aspects of nursing documentation. We've got some slides coming up just about that. We wanted to identify what the barriers were for patients talking about bowel movements and bowel motions, and what we actually discovered is perhaps that we're the problem, the staff are the problem. So that was kind of interesting for us and a very good learning. We're working on patient posters, and we've had a variety of different successes with those, and we're still learning every day. Working on nursing education in terms of physical bowel assessments and really understanding what underpins constipation, so incorporating all the physiology, pharmacological aspects as well. Our big one that we think will be quite important to what's going on, as with every other DHB, is having some sort of flowchart algorithm, and that's taken us some time to develop, so we're very close to testing that. So for those who've been at previous learning sessions, you might remember we had a couple of catchphrases. It's cool to know your stool, or the scoop on the poop. And we tested those with patients. We've been around several patients, and what we learnt is that perhaps that wasn't the right context. So, we've learnt from that. So we've put something a little bit more serious around that. So we've kind of gone with the theme, there's no need to rush, check before you flush. Help us to help you is what we're looking for. This is still going to have several iterations of that poster. We're working with our local kaumātua and trying to be really culturally appropriate, and so we're working with that. On the right there you'll see we've got our DHB loves those little lanyard cards, the little cue cards, so we've worked on a nursing documentation one, so it's bowels opened, what type, bringing that all in together. And the staff in the Star Ward are very proud of that. They helped work with that idea. It was about getting them involved with what we could do. Guideline. We like to think that they don't take too long to put together. We've adapted originally from Canterbury. They had one that we've brought into our local context. We've been very privileged to have a registrar on our team and some highly motivated pharmacy staff who've really taken the lead on this and will help us with the training and implementation for this. We're also very lucky that the registrar that's on our team is soon to be posted in the Star Ward next year. So it would be interesting to see what our data shows from when it's implemented and him also working in that ward. So what's the data showing? We are seeing a bit of a change there in the co-prescribing of laxatives with regular opioids. We're definitely seeing an improvement on the nursing documentation related to that card, and we feel that, and Prem might have some discussions with us around that, we just want to analyse it. We feel that as the nursing documentation's improved, the prescribing's improved. Outcome measure, that's what we're all here for. We haven't seen a change yet. We've got 2 more data points since I put this presentation together, which we've got 3 weeks of zero constipation. We're absolutely ecstatic about that, but we just need to keep grounded on that and making sure it's not just a normal variation. We've got our balancing measures like many other people working on constipation for keeping an eye on the pain and also the diarrhoea. So we've had lots of learnings, as everybody else has.
One learning that I took was from the pre-reading that we all read, yes. There was pre-reading of it was a how-to guide from the 5 Million Lives campaign, and in there was a quote that resonated with me, and I encourage you all to read it. And there was a quote that came from a nurse in Detroit, and she was quoted as saying, "Collecting improvement data is just as important as taking vital signs. It all contributes to better care for the patient, and that's the goal of our work." So I thought that was really appropriate. Some of the other learnings that we've taken is we did a quiz with staff really to understand what their knowledge was and how we could understand the system and what we needed to do. So we did a quiz around what medications were an opioid, and we found it interesting that most of the nursing staff didn't identify tramadol as an opioid, so we thought we need to do some work around that. We had a scenario put to a lot of our medical staff in that quiz around a presentation and what they would prescribe, and we thought it was very interesting that they chose ondansetron as the first-line antiemetic to co-prescribe with opioids, despite its constipating effect, so we'll have some conversation around that. In terms of learnings around the communication methods, in particular for the nursing documentation, with the nature of working on a shift work and a ward, it's really hard to get that story and that information to everybody. So we've had to try various techniques to get that information out there, and I've just seen I'm over time by 1 minute 30. Ooh, sorry. Struggles is it's our rehab ward, so patients are already coming constipated, but we're confident that with our nursing documentation and when we get the guideline that we'll be able to address that. We've had some delays, as everybody else has had. A little struggle is about monthly meetings. We're all committed, but it's really hard to get together more frequently than monthly, so sometimes that just is a slow in trying to implement some of the changes. Our successes, we're really proud of our team and what we're trying to achieve to improve patient care. Thanks.